HealingYourself.life provides information for awareness, educational, and support purposes only and does not diagnose or prescribe treatment for any medical condition. Viewers are encouraged to do their own due diligence and consult with their own medical caregivers before making personal treatment decisions.
Welcome back to HealingYourself.life. We're back with our off-grid medical doctor, Jay Nielsen, MD, a family practice doctor in Northwest Ohio and the owner of a survival compound in Haiti, which has been doing some major upgrades recently. We're here to talk about what's truly a crisis for Americans who are using medical care and the financial divot that it takes out of their lives. It's truly causing. We've had people who have to go back to work after retiring because they can no longer afford the COBRA cost. We've had, in my own experience, we'll talk about a 10 times difference increase in prices between the different providers. So can you talk to us about the current debate around single payer and why it might be more of a nightmare than a dream come true?
Yep, I will get there. It's on my list. I have a plan today for making sure we cover where we are, where we could go, what we could do to fix it, and what you as a consumer can do to stay out of the system and still get good health care. I want to cover all of that. You mentioned the fact I have 12 years working on my Parasite, and I'm pretty much done. $2 million, and I'm really pleased. Also, I always run into something in the news that I've got to bring up first. This was on the Drudge today, okay? And they've figured out that all these beached whales are all from EMF. And it's screwing up their sonar systems, and they're all beaching themselves because of those ELF submarine guiding systems and radar towers, and they're just beaching themselves because they're completely disoriented. And so they're capable of killing whales that are living hundreds of feet underneath the sea with water protecting them. Wi-Fi doesn't travel through water very well or any of that stuff, and yet it's okay for us. This is our basic problem in America. We are the 17th least healthy out of the 17 top industrialized nations in the world. We have the most expensive healthcare in the world by a lot, and we're getting nothing for our dollar. Okay? If you start saying, well, how could we fix this? One of the things I would suggest you do is go up on the American Association of Physicians and Surgeons site. This is the organization that is against the AMA and represents docs. And when I opted out of Medicare, they taught me how to do that at no charge. They basically help docs stay in private practice. They're very much interested in returning to good health care. And this is off of their website under options, and they kind of start out with the Oath of Hippocrates, and they go, if we're going to reform this, we've got to repeal Obamacare, promote private practice medicine, eliminate third-party payments, get rid of block Medicaid, replace price controls with competition, reform the tax code, lower barriers to life-saving treatments, remove barriers to market entry. A naturopath should be paid if people think that's their value, or an acupuncturist. Get rid of the barriers. Reduce liability. It's increasing cost to all of the doctors. Make due process with state medical boards fair. And get rid of this thing where Medicare, decides what's covered. And I thought, well, that's a pretty good summary of what's screwed up. So I thought I'd start there. Here's one of our problems that's wrong. You can go up on a website, ProPublica.com, and you can look up your doctor and find out how many kickbacks he had. Right now they're doing 2017. Okay, they're always behind. It takes them a long time to collect this stuff. I'm $310, and it makes me mad because these reps show up with a pizza, and I tell them I don't want it, and then they put me down that I ate the pizza. And I've rejected $310 in pizza and donuts last year. So it's not completely accurate. There are docs up there that won't participate in kickbacks, and they still say they do it. But this guy had $26,000 in kickbacks. the big players, the guys that are doing things like buying pacemakers, they can get up into $500,000 a year. Here is the basic problem with what's wrong in America. This is my bill for something that happened to me last year. Okay? And at the bottom, it says that the hospital wanted MedMutual, my insurance company, to pay $234. That's what they thought was a fair bill. And Medicare allowed $99.77, so 40%. And then they got Humana to pay $79 of it, and Medicare paid $20 out of a $234 bill. They paid 10 cents on the dollar. So we're talking about Medicare for all. So you're not going to have that cost shifting. You're not going to have anybody coming in and saying, oh, I'll pay Medicare's bill because Medicare won't pay it. It's going to be all Medicare. And so Medicare is going bankrupt right now. And they're only paying 10 cents on the dollar. What happens when they have to pay 100 cents on the dollar? I don't get Medicare for all. I was listening today on one of the networks to that guy that's running, from Starbucks. That's Schultz, that's talking about running independent. And I haven't got my finger on his pulse yet, but he's doing the Ross Perot thing. He's going to tell us the truth. And the truth, I love light. Illuminate things. He is going to sit there and he just says, the Democrats are socialists, the Republicans are all corrupt. The government doesn't work at all. Don't trust anybody. We need to start all over again. Okay, this is all broken. That's a good message. I like it. I don't know whether or not I want him for president. He's probably going to end up causing the Electoral College not to have a majority, which means that the House of Representatives gets to pick the Democratic candidate of their choice. But I always keep saying, I think the best thing we can do is let the Democrats have the thing for a while. They just keep running in the ground. Eventually we'll figure it out. But I'm not waiting for the Republicans to fix it. I have a lot of stuff I want to show you very quickly. That's out of sequence. About alternatives. Okay? This is really the right alternative to health care, and this is the high deductible or catastrophic health insurance policy. Okay? And the advantage of a high deductibility policy where you don't let anybody insure their first $8,000 or $10,000 is almost all health care in America goes to cash. And the minute we go to cash, we get competition. And we'll show you what competition does to the cost of health care. Because I live in that world. It's what I've done for the last 40 years is cash care. And I know exactly what it costs. And so everybody, the Republicans and Democrats, they all want to keep their insurance companies. They want the government to do it because all those layers, they all get to keep 30% of everything they make. Everybody says, oh, my insurance company's trying to save money. No. I go, no, they aren't. They're trying to spend as much money as they can because they get to keep a third of it. That's just plain facts. They don't want to save money. That's the reason why they won't pay my office visit, but they'll pay $1 million liver transplant. Mm-hmm. Because it only costs them $25 to bill a liver transplant, and they get to keep $333,000. But when they pay me $79 for an office visit, it still costs them $29 to bill it, and they eat up their third. That's how healthcare works. So, do we have a model for the best healthcare in the world today? Who is doing the best job out there? Okay? That's the question. And everybody argues about that. I haven't argued about it for years. The jury's in as far as I'm concerned. No, it's not Cuba. Okay? No, it isn't the Dominican Republic, and it sure as heck isn't the United States. It's the French. They have the lowest morbidity and mortality in the world. They're the best quality health care. They're number 17 on the list of 17 in cost. We're the opposite. We're 17th in quality and first in cost. They're first in quality, 17th in cost. And they have the highest physician approval of their own system. Their physicians and providers like what they're doing. America's last. Okay? Switzerland's up there, doing a nice job. UK's hanging in the middle with their socialized medicine thing because they kind of split private practice with socialism. And so the reason that the French healthcare system worked is what they did is they eliminated a lot of their overhead. If this is the chart for running the federal government in France to do healthcare. If you did this to Obamacare, there'd be like 700 of these blue boxes. Okay, and the lines would cross each other and it'd be a nightmare. They really simplified government involvement. Basically, they run healthcare. We assume in America that every doctor, every hospital, every insurance company is completely criminal and stealing everything they can. So every case needs to be investigated and prosecuted to catch you and recover the funds. And we call that paying people back and rebates and whatever, that whole thing where I get paid and a year later they come back and say, we've decided we shouldn't have paid you that, send some of the money back. And sometimes they do that to a whole block of patients. I had one year that my partner had to pay back $300,000 and it just about put him out of practice. And so they're not doing that. They're doing the same thing that you're doing at Kroger's or Napa. They assume that if you see me as a doctor and I tell the government, I saw this guy for a level 4 visit, send me my $59, they go, you did it. Here's your $59. They don't investigate each one. They don't fight over each one. What they do is they watch the processing pattern and they see people who are outliers, and then they look at the outliers and they go, this guy's not legit. But if you're kind of doing the same amount of business as everybody else, nobody's in prosecuting Kroger's over a carton of milk. They're going, nobody complained, pay the bill. Okay? The French have gone to that. They're not doing a whole bunch of administrative oversight. The big thing that they did, two really, really big things that they did, is they went to free market. And so they went out to all the MRI scanners and they said, everybody put in a bid for what they can do an MRI for. It came back to be $343 for an MRI without contrast, which you'll see that's ironic later when I get into my cash MRIs. And so they said, okay, that's what the government pays for an MRI. So if you want to go to some place that charges $422, okay, you're going to have to get your money out. But you can get free health care if you go to the place with the lowest bid. And then the market just automatically fluctuates through the ability of that one company to provide enough service. They go, wow, we're so busy, we can't do that. Their prices go up, payment to everybody goes up, or competition goes down. But it's free market. Mm-hmm. There's competition. And so we're paying $6,000 for an MRI that you're getting for $343 in Paris. Mm-hmm. Okay? They will not allow oncologists to have the government pay for any chemotherapy that doesn't work at least 20% of the time. That got rid of 80% of their chemo. 80% of their chemo didn't work 20% of the time. Wow. Okay? They have eliminated Chinese drugs because they know it causes more healthcare problems than it helps because there's so many counterfeits and so much crap. We just watched the valsartan controversy with all the poisons in the valsartan. And they're pretty much not allowing any American drugs because the American drugs are all inflated in price. Mm-hmm. And in having done that, they pretty much have gotten control of their healthcare costs, and to the point where the doctors are happy. Their general consultation first visit has a copay of $7.30. Their psychiatry consultation has a $12 copay. A root canal has a $30 copay. A tooth cleaning has a $9 copay. It's pretty affordable. Mm-hmm. And there are copays because people need to have skin in the game. Their inpatient hospital one day is $22 copay. Their doctor visit's $1.20. An ambulance is $2.40. And they're doing that. They have multiple places they're getting that revenue. One of the places they're getting about 10% of the revenue is from taxing alcohol and cigarettes. And they're doing that thing I've always recommended where why don't you go tax the things that cause disease and let the market work that out. Canada figured that out 20 years ago, and they said, we're going to tax cigarettes until we get enough money out of them to pay for all the emphysema and cancer. And cigarettes for a while were getting up to like $10-12 a pack. And then everybody quit because they got too expensive, and cigarettes settled in for about 30% more than America. But they just, if you do that, the market will correct the problem. If we took the cost of alcohol in America and taxed it at a rate that paid for all the automobile accidents, head trauma, alcohol rehab centers, domestic violence, and everything, a bottle of scotch would probably be $400 or $500. I mean, you can't even do the math. You could never get high enough. You'd virtually be back in prohibition. Okay. So here is total health expenditures. This chart's a little old, but this is 2010, and that's the United States over there. And you're watching 1995, 2000, 2005, and 2007. So you're seeing the growth in healthcare for each one of these markets. They're
Cost.
all growing. This is the cost.
Expenditure, okay.
Expenditures, okay? Okay, so everybody says, oh, rich doctors, okay? Like, deal with that one, okay? 10 years ago, doctors were 8% of all expenditures in the United States, even though we're basically doing all the work. Everybody else is.
Of medical expenditures?
Total. Nationwide, 8% of all the money that is spent in healthcare actually goes to a doctor for anything.
Healthcare, okay.
In healthcare, right, okay? And so I'll put this up so if anybody wants to screen capture it, because it's a really, really neat chart. 6% of physician practice owners' income decreased by 6% between 2007 and 2011, 2012. Here's another year, down 5%. Okay. Overall, my income has gone down in dollars 27% since I started practice in 1981. That's not adjusted anything, nothing. When I was in practice in 1981, I was making $156,000 a year. I'm now making $140,000. Okay? Is anybody else doing that? Nobody else is doing that. Everybody else has got cost of living increases and they're going up. Mm-hmm. And we have continually, doctors have been dropping for a long, long time. And because of that, we used to be considered upper class. And now we're middle class, okay? Physicians spend 40,000 hours training and more than $300,000 on their education, yet the amount of money they earn per hour is only a few dollars more than a high school teacher. On average, non-primary care doctors earn $116,000 more than primary care. During the 3 to 7 years of medical residency, physicians in training who abide by the maximum 80-hour work week, I was closer to 110, mandated by the Joint Commission, make about $11 an hour before taxes. I made $3.81, but then again, it was 1978, okay? Some residents work more than 100 hours per week, and they're even lower. And, I agree with that number. Primary care physicians earn barely more annually than the amount they accumulated in debt from medical school. Period. Okay? Family physicians spend 1/5 of their time performing activities outside of the office that are not reimbursed. That's 20%. I'm probably 30, I would guess. Volume, not quality, determines pay. This is what happened when doctors joined hospitals and left private practice. I spend 30 minutes with every patient that I see, unless they intentionally come in for like a script refill for 15 minutes. But I spend more time doing a script refill than most doctors do working up your brain tumor, Now, so we got the doctors are just disappearing. There are fewer and fewer doctors every year. But here's a chart of the growth of administrators in medicine.
The physicians is that little dark area way down at the bottom of the chart. I see barely growing at all.
Right. The physicians are on there, and they're that little bottom wedge right there. That's the growth in physicians, and this is the growth in administrative staff. When I was a young physician and you'd go into a small hospital, 40, 50 beds, the entire administration was an administrator and a secretary. You walk into that same hospital today and there may be 10, 12, 15 people. And that's just little hospitals. Oh my gosh, you get into the big hospitals and they've got entire,
additional wings, yeah.
Yeah, additional wings, right, okay. Here's one of our problems, okay, physician compensation. Okay? And way down there at the bottom is pediatrics and family medicine. Okay? Now, these numbers look pretty nice. Hey, I'd take that $207,000 for family practice. Of course, I had to join the hospital and sell my soul and see 7 people an hour and do all that thing. In private practice, that number's still sitting down at 130. Okay? Here's the one. We've talked about this before. I think we even used this chart. 50% of all doctors in the United States today are over 55. Now, that used to not make any difference. My dad practiced until he was 84. So 65 was no number to him. Yeah, the last 15 years he slowed down just like I'm slowing down. But he still saw a lot of patients. And so now everybody's joined the hospital. Well, everybody's vested at 65. They all hate their job. And so 65, they're out. And so we've lost 15 to 20 years of productivity from all our primary care docs. Okay? And so we've got all these docs that entered medicine with me or 10 or 20 years behind me and thought they would practice until they're 75 to 80. Now they all hate their jobs and they're all getting out at 65. So as a result, this chart's actually low at 130,000. The latest results are now 217,000 doctors less than we have today. In 10 more years, we're going to have a loss of almost 250,000 doctors. We ought to be going up. We're not going to go up. We're going to go down. But don't worry, we got all those nurse practitioners. They'll take care of that for us, right? Match day. Match day is the day when all of the medical students decide what field they're going into. Percent filled compared to available slots. Family medicine has dropped to 44% full. I think I mentioned here one time on one of our talks that when I came to my town in 1972 to start medical school, there were 6 family practice residencies in a town of 500,000 people. Each one of them had 6 residents in each year, 3 years, and we were putting out 36 family practice residents, 65% of which stayed in our area, northwestern this state, southern and northern state, but stayed locally, years and years and years. And July 1st, our last family practice residency closed and we have none.
Huh.
We have no effort to make any family doctors here at all. If we get them, it's because we paid them a lot of money to come from Area 51 or Minnesota or whatever, and that's a whole bidding war, and the bidding war just creates more and more expenses. And nobody's here because they want to be near their mother-in-law. Okay? Change subjects. Electronic medical records. Do they work? I'm on electronic medical record. I've been on the same one for 25 years, and it's pretty cool. It's called Soapware. It's out of business, and I'm on version 4, and they were on version 11 when they quit. And that's why I can't leave Windows XP, okay? And all it is a macro editor. You know, I write MAC and hit spacebar, and it writes macro bid and saves me a lot of time. And I've been doing it now for 25 years, and I can just sit there and write a chart. But everything that I macro edit, I wrote, and I intended to say that to that patient at that time, so it's a part of their record. But I get records from emergency rooms now, and they only came in because they had a 1 centimeter laceration and got 3 stitches, and the stitches are to come out in 8 days. That's the only information I need, and they got a tetanus shot. That's the information I need from the chart. And the record is 27 pages long, single space, and the 3 pieces of information I need are on 3 different pages and buried in a 10-point font, but I know whether or not they have a gun at home. Well, I don't know that. I know they were asked. I know whether or not anybody beat them up. Do they have any domestic violence? I know all kinds of things that the government is going to give you an extra $2.50 if you ask that question. And the hospitals have perfected this process of putting all of this stuff down on paper. None of it usually happened. Nobody really asked the question. They just say it did. And then they get more money than I get in practice because I didn't play the game. Electronic health records are a nightmare. The VA had a really interesting system where when you wanted to prescribe, you'd slide a scroll bar down, and these little 3 millimeter wide bars would show up. One would be green, one would be white, one would be green, so you could see them. So my macrobid for a urinary tract infection, I'd hit it, and it would write macrobid. Well, no, it wouldn't. It might write the next thing up or the next thing down. Well, when I write it, I watch it be typed. But you didn't get to see what you wrote. And 15% of all the prescriptions the VA was writing for the wrong thing. And they had to go change their entire electronic medical record because it was screwed up. And so you have these EMRs. It's so easy to generate stuff. But it's not because you have a treatment plan and a differential diagnosis. It's because your manager of your hospital group is back at you going, hey, you only did 3 MRIs and you contracted you do 7 a month. By Friday at 5 o'clock, you need to write 4 MRIs. And so the guy walks in and goes, okay, let's just add a neck MRI to this one. Let's do it. It's a mess. Okay. Health records don't work. Drugs. Wow. We could just do a whole show on this. Okay. First of all, we watch Skakel do that thing where he bought injectable progesterone that my custom compounding pharmacist used to make for Medicaid for like $22, and he took it to $2,300 because he bought the patent. And then my custom compounding pharmacist couldn't make it anymore because it was illegal because he bought the patent on a 50-year-old drug. And then he's charging Medicaid $2,300, and for some reason they decided it wasn't good for him to do that, and he went to prison. Okay. But everybody else who's doing it is getting real rich. And one of the things that's driving up our drug prices is Part D Medicare. Because Part D Medicare, when they went to the pharmaceutical industry and said, you guys are going to have to bring your prices down, the pharmaceutical industry said, you got to give us a monopoly. And so I used to have like 5 different companies that made vitamin B12. Now only American Standard makes it. So American Standard has like 30 injectable products that they make, and they don't make them all every day because it's easier to pour everything into a 55,000 gallon vat and do the chemistry and set up the machine and say, there's all the B12 for the next 6 months. Now we're going to go over and we're going to do something else, thiamine. Okay. Well, if they miscalculate need, they can't get back to it till they get through their manufacturing cycle. When Plan D came in, I was paying $2.36 for 15 2cc doses of vitamin B12. Okay? And I'm now paying $128, up from $2. And that's Part D Medicare. That's what Part D Medicare does.
So we just need Medicare for all.
Medicare for all ought to solve it. Ought to be good. Okay? If you want to really see an interesting YouTube, put in Pharmacy Benefit Manager, okay, and then look for that YouTube from that pharmacist in New York who isn't a pharmacist anymore, and you'll find it because it had like 2 trillion hits, and there won't be any other thing that's got a lot of hits. This guy made national news, okay? Every pharmacist has to sign an agreement that he will never tell any of his clients about pharmacy benefit managers. If he does, they can sue him and take his license. And this guy took a bullet for all of us and finally explained to the world what pharmacy benefit managers are. They're a big loop to increase the profit for the insurance industry. And this is Wikipedia's definition. We'll start with the statement, the neutrality of this article is disputed. Relevant discussion may be found on the talk page. Okay? In the United States, a pharmacy benefit manager, PBM, is a third-party administrator of prescription drug programs for commercial health plans, self-insured employer plans, Medicare Part D, and the Federal Employee Health Benefits Program. And they are responsible for developing, maintaining the formulary, contracting the pharmacies, negotiating discounts and rebates with drug manufacturers, processing and paying prescription drug claims. That was very generous. They're in the business of making sure that all drugs are expensive as possible, and everybody who's in the mill making them expensive gets a kickback. And we're not allowed to know that they exist, because if we knew they existed, we would have Nuremberg war crime trials and we would put them all in prison because they're all criminals.
If I could interrupt there, we've interviewed a few guests on our show who have talked about if something doesn't pass the smell test, if it doesn't pass the gut check, if you can look at the outside and you can say, I can see from the outside that there's a huge gap here in logic or in numbers. It doesn't add up. It doesn't make business sense from the outside. I'll just give a quick personal anecdote, is that I recently got treated with an IV for low iron in the blood. I've typically gone to a local clinic and they do it. Their price that they want to charge for that is about $1,300, and the insurance company says, no, it's only worth $576. I mistakenly went to a different provider and was unable. They wouldn't tell me the price ahead of time. I tried for 2 days.
I love that.
I tried for 2 days. Talked to the people who schedule it. Talked to the practice manager, and when I got the bill within a week after that, suddenly they figured out right after I got it how much it was going to cost. And instead of $1,300, they asked the insurance $10,500. The insurance said, no, it's not worth it. It's the same insurance company and the same medication. Instead of saying the first provider, oh, it's worth $576, they told these people, we'll only pay $4,500. And you look at that and you go, what business would have a contracted, negotiated price for the same exact procedure and the same exact medicine, the same brand name, everything was the same, and tell one provider it's only worth $576 until they want it's worth $4,500, and then they have the gall to put on the thing, we saved you $5,000.
Exactly.
But no,
And
what?
and that happened because in your second case, they had a pharmacy benefits manager working on the case, and his job was to increase your charges. And meanwhile, they probably only paid $100 for the drug.
Right. And
they probably only gave the nurse and the doctor who administered it maybe $200. Okay. And everything else, I tell people that all the time. I watch, my boys are both interventionalist cardiologists. And they go in and they do a cardiac cath and put a stent in your heart. And come on, these are some of the most technically difficult procedures in the world. Okay. And these boys are the best there is. And they go in and they spend an hour and a half. Some caths can get really ugly and go 3 hours. And the hospital gets $15,000, $20,000, and they get $231. How is that right? Everything is designed to go to the American Hospital Association dues-paying members and the American Pharmaceutical Manufacturers Association dues-paying members. Those two organizations run our healthcare. Okay? And after that, everybody else is powerless. Doctors are powerless. Okay, let's fix some of this. There was nothing but bad news in that. Okay, now let's go get some good news out. Okay, so you need to save money on your meds. Okay, I have been using this company for a long time. This is the company that I use to get my meds, and Donegan uses this as well. This is globalpharmacyplus.com. Okay, this is a Canadian pharmacy out of Vancouver, but it's very important to recognize that this is a European pharmacy, whereas the ones you see in Canada, they're Chinese pharmacies or Indian pharmacies. They're a whole different product. You know, and sometimes these people now are, to stay competitive, are starting to show some Singapore, etc. But you never see Chinese or Indian crap from them. And I want to show you an example of what this can do for you. And I tell people you should take all of your meds, no matter what you're paying, get your slip out, because a lot of times you can get a higher quality med for less than your copay. Okay? And here's an example. This is the Combivent inhaler. This is not just Proventil, this is Proventil and ipratropium, okay? This inhaler at your local pharmacy is billing out at $330 to $500. $20. Now, what's the copay on a $500 product at the pharmacy? It's going to be more than $20, okay? And so all you do is you go up to this is the main page, and you type in any drug. And it's pretty smart. If you put in atorvastatin or you put in Lipitor, or in this case you put in Respimat or Combivent or ipratropium, one of the ingredients, it will come up to a page of things and you can look down it and you can find the product. If you don't find it, they don't carry it. Okay? But I've got a list now. One of my favorite stories is I had a drug that I gave adolescent girls for menstrual cramps, because 1/2 of all missed school for girls in high school is for menstrual cramps, no matter what the school slip says. Okay, so it's a big deal. It's a big health problem in America. It's very disruptive to education. Okay, And this drug is just an anti-inflammatory, but it very specifically works better than all the rest of them. And you only need to take like 6 tablets to get through your period, okay? And so a bottle of 50 of them lasts half a year, 9 months in school, or whatever, not a lot of money. And all of the time I ever prescribed it, it was $15, $20. All of a sudden, a year ago, went $2,600. Somebody bought the patent, just like Skakel bought progesterone. Somebody bought the patent and went $2,600. And I went, uh-oh. And I just forgot about Global. And one day I was up on Global and I thought, Ponstel. I typed in Ponstel, $40 for like 3 months supply. It was incredible. My favorite gout drug, Uloric, which works better than any other gout drug by like 5-fold, is $700 a month to your pharmacy, and I can get 180 days for $70. So I'm paying $13 a month, and in the United States it's $700. Okay, and so, educate yourself and go find your cash and quit asking your insurance company to do it and get the heck out of Dodge and pay cash. Okay, I found this. This came the other day with one of my cultures, and it's an internal document from the hospital to calculate their profit, and they accidentally put it in my note. And it says down here that IV Cipro is $2.06 for 400 milligrams, the standard dose. Okay, try 500. Okay, this is like $500 a dose at the hospital, and they're paying $2.06.
Yeah, of that sticker shock that I reported on my iron IV, you're right, 90% of that sticker price was the medication itself, was just this little IV bag of ferriheme iron. And that was the item that was 10 times as much negotiated. So come back, help me understand this. Why in the world would my insurance company be willing to pay? They always brag about how they have the negotiating power of high numbers and that sort of thing, so they can keep costs down and that sort of thing. So why would they be willing to pay 10 times as much to one provider for the same exact material, the same brand name, everything?
It's really, really simple. They get 1/3 of all the money they charge. So if every year they charge more, premiums go up 20%. We saw that under Obamacare, 20%. Congratulations to Trump. He actually got them to go down a little bit, not go up 20% for the first time in 8 years. But, when you look at the whole thing, they want to spend as much money as possible, because as it goes through, they keep 1/3 of it. And so, and they own the pharmacy anyway. All these insurance companies and hospitals and pharmacies are all owned by each other now. The mergers are phenomenal. You can't even pay. You can't even figure out who owns who anymore.
No, that's even true. When I was arguing about this prices with the second provider, the expensive provider, I realized that the people who I'd been working for months to argue with, they're not even the same company. They're another outsourced company. So the medical provider said, we can't tell you what the price is because we only do the medical part.
Right.
But the day after you get the service done, then the billing company's after.
Sure. And say, here's how we're going to get you.
And they have the same name, but it's a separate company. And then and that gets more and more entangling after that. But if your car started making a funny sound and you go to the mechanic and say, hey, my car's making a funny sound, he says, yeah, I know what the problem is. We're going to have to change out the rotors on your brakes. You say, how much is it? Oh, I don't get into the business end of it. I only do the fixing.
We'll let you know later.
Do you want your car fixed or not?
Yeah.
And you say, I guess so. I got to go leave town tomorrow.
Yeah.
So then you get the bill from the other people and they say, well, you should have known. It's like,
yeah, you should have known. Yeah, exactly.
Jeepers.
This is an article that was in the Wall Street Journal. Okay, very interesting article. And what it said was that if we went back to the pharmacy system we had in the 1920s, where pharmacists actually made things, and you actually collected the raw powder and had the pharmacist work with you to put it in whatever form you wanted, liquid, suppository, etc., that it would bring costs down. Well, what's the FDA in the business of? They're trying to put custom compounding pharmacists out of business. I found out that Xeljanz, the product for Crohn's and rheumatoid arthritis and all of the psoriatic arthritis, one of those ads on TV, I found out that Xeljanz, you see these people that they're born with a genetic disorder and they have no hair. It's called alopecia totalis or alopecia universalis. I have 2 patients in my practice with it. If you take that drug and you put it in an alcohol-based solution and rub it on your scalp once a day, within a month, all your hair grows back. And you only need, this drug is $7,000 a month, and you only need $40 of it to make your hair grow back. Do you think those people would pay cash for that?
Mm-hmm.
Okay, so I called up my custom compounding pharmacist and said, I got 2 patients, I want to do this. And he said, the minimum order is $7,000. The company will not sell me less than $7,000 worth of it, so they're going to keep me out of the market. He says, so I'm supposed to buy a 10-year supply for these 2 patients and hope they keep coming, and I'm supposed to internally bank that $7,000. He said, if you can get the 2 patients to put up $3,500 apiece, I'll put their name on the jar.
Oh my.
And everybody went, you've got to be kidding me.
Yeah.
It's all rigged. Everything's rigged. Okay, surgery. This is the cost of a hip replacement in Switzerland, Spain, UK, Canada, France, Netherlands, Germany, and the United States, of course, is the big bar. Look at that. $7,000 in Switzerland and $35,000 to do a hip replacement in the United States.
This is where we get the term medical tourism.
I'm coming. Don't get ahead of me.
Okay.
Got that covered. Okay. My brother did that. Okay. This came to me in the internet the other day, and I saved it. Google needs surgery ? Questions to ask. And what they're telling you is don't ever have surgery from somebody who hasn't done 50 of something in the last year. Unless nobody's done 50, like a Whipple, and then you say, okay, I'm going to go for 20. Okay? And your morbidity and mortality from surgery, from asking that one question and finding out what experience surgeons have. And if somebody says, I did one last year, run. This is Medigo, okay? And this is one of the hospital systems at United Arab Emirates, okay? And you can go to Dubai and etc. My brother had this really rare eye disorder where his thyroid got whacked out and his eyes bulged out, and he needed this surgery where they go in and debulk the eye muscles. And the only person who did it in the Midwest was at my local massive tertiary care center. And my brother has never had insurance because he made some really good investments when he was young. And he's always had money, and he just pays as he goes along. And he wasn't Medicare yet, so he didn't have any insurance. And so he shows up at this tertiary care center and sees this doctor, and the guy says, you're going to go blind if we don't operate within the next 6 months. And Jeff says, what's it going to cost? And he says, honestly, I don't know. I'm not in that business. Mm-hmm. Go down to the business office, and they'll tell you. So my brother goes downstairs, and they say, well, we charge $70,000 for that surgery. But you don't have any insurance. And he said, no. They didn't ask him if he was worth millions of dollars. Mm. They didn't do a means test. Mm. They said, you don't have any insurance. 16. Okay. So my brother went home and he scheduled surgery at this tertiary center that will go unnamed. And somebody said, have you looked into doing that in Dubai? And so he went ahead and asked this medical system in Dubai, do you have a specialist who does this? And they said, yes, we do. Okay. And so all he had to do was pay his ticket to get to New York. Once he got to New York, he got in a private jet with 6 other patients, and he and his wife flew to Dubai and stayed in a class 5 hotel room surgical suite that she stayed with him. And he got there, about 2 hours after he got there, his surgeon from the tertiary care center walked in.
What?
And he said, I got the same surgeon? He said, why didn't you tell me this? He said, well, I'm not allowed to tell you that. They'd fire me. I can't tell you I'm over here. He says, these people have all the best people in the world coming over here to do surgery. And he says, I love it here. I says, my surgical suite is state of the art. My post-op care is superb. And he said, what was your cash price at my place? And he said, $16,000. He says, what is it here? And Jeff said, 11. And he stayed, and they came in and said, we know you're not from here, and so stay as long as you want. Just stay in your room. We'll keep bringing you meals. And if you and your wife want to go out and do some shopping in Dubai or take a tour or anything, go ahead. When you're ready to go home, give us a call and we'll put you in the next jet back home. And so they stayed in Dubai for 4 or 5 days and vacationed on their healthcare dollars that were all cash. True cost of healthcare. You think those people aren't making money? About 6-7 years ago, I started a website, faircareforall.com, okay? And my purpose was to get people to understand what you could do with cash healthcare, okay? And it didn't work with crap, okay? The only thing it did was the same thing I do today with Voucher Lab, and other than that, I basically was a referral site. I had people contact me from all over the world and say, how do I get this in San Francisco? Mm-hmm. But I didn't have anybody here ask me for it. And so after a while, it was just a bunch of work for nothing, and I gave up, okay? But let's go to lab, okay? Let's talk about lab, okay? Here is an ad. Oops, I can't do that. That's got a name on it. Sorry. Let's go to. Ooh, I can't do that. That didn't black out very well. Let me keep working here. I'm going to get this down to the point where nobody sues me. Okay. Okay. And if you want to do a screen, how did it do? Yeah, it did. Okay. Get a screen capture on that. Mm-hmm. Okay. What you're going to see here. Let's just take right at the top CBC and differential, the basic blood count.
Complete blood count.
Complete blood count with the differential. And at my local hospital, it's $239. Another hospital's $178. Another outpatient service is $150. And my local physicians group, okay, is trying to undercut everybody and provide cash care, and they're 20. And I'm 12. Okay? So, do you think I'm doing that out of the kindness of my heart? No, I'm doubling that puppy. It's $6. Your CBC costs $6. Your hospital's charging you $239 for a $6 CBC.
But your insurance company will tell you, we saved you $100.
That's right. That's right. Because then you send that $239 in, they go, we're only paying $180. Okay. So now you have to look at this. Here is PSA. Okay. And that PSA at the local hospital.
That's men's prostate.
Yeah, prostate surface antigen, $254. And my local medical group there was 45, and I'm 28. Okay? And I'm telling you, my lab's the best lab in my entire area. This is the best lab that I'm working with. And so you go, why does my lab do this for me? Well, what they want me to do is they want me to go ahead and bill insurance for it and take it back up to the $239. And boy, I make a lot of money. As a private clinician, I can't do that. But if I can get into a group, okay, and play all the paperwork and everything, I can make more money selling lab to my patients than I can make practicing medicine. That's why it exists. What I'm doing is, we call it a voucher program. And what you do is you bring your prescription in, hand it to my girl at the front desk, and she says, okay, all this lab is going to cost you $150, which means it would have cost you $2,500 if you handed it into your insurance. And then you pay me on your credit card so that I know I'm paid. Mm-hmm. And I give you a prepaid voucher with your script back, and you walk into my local lab, and there can be no surprises, okay? You paid in advance, you agreed in advance. Nobody's going to call you up later and say, we need to adjust your bill. We've all been through that, haven't we? You just did it, okay? And so, I'm doing a lot of this. I have been doing it ever since I opened Fair Care for All. I've been doing a lot of this. I probably make 20% of my income off of selling lab at 10 cents on the dollar when it cost me 5 cents on the dollar. And so, what are they doing in France? They're doing my prices for lab. If we had an open market, what would happen to the cost of lab if everybody had to publish their prices? But you're not allowed, I'm not allowed to show you the name on this. It's just crazy. Yeah, I gotta do this one too. I thought my Sharpie worked better than it did. I'm gonna put my fingers in front of that. MRI, $325. They got 3 scanners around my area. They can get you in tomorrow. They have the best radiologists from all over the United States reading by telemetry. They have wonderful service. The only problem is what they do is there are more MRI scanners in my town with 350,000 people than there are in all of Canada. That's how overpopulated we are. So these people come in, they say, oh, I want to get into the MRI market because there's a lot of profit. And then a year later, they go bankrupt. Well, what this company does is it costs a lot of money to buy an MRI. It costs a lot of money to tear it down. It costs a lot of money to move it. It costs a lot of money to reassemble it. Okay? And so, and you usually have got a lease. And so what happens is when they go bankrupt, this company walks into the trustee for the bankruptcy and says, I'll offer you $200,000 for the balance on the lease. And they can do that. Trustee can do anything they want. And the machine. And over the last 15 years, this company has bought the newest machine they can find that cost millions and millions of dollars, buys it for $200,000. And what's that, $325? Labor. All the money's going to the radiologist and the tech. Now, remember, I told you $343 for an MRI in Paris. Isn't that ironic? There's the American cash price. We need to go cash. What we know, I could fix all healthcare problems in America tomorrow with one 3-word law in the U.S. Constitution. Insurance is illegal. No, we've got to make it 4. Health insurance is illegal. We could probably talk about other insurance. It's all about as scammed up, but health insurance sets the record for scam. You know, I always marvel. I remember 30, 40 years ago, I had a pretty nice house and farm out in the middle of Ohio, and my insurance company, I got my bill to insure the whole place, and it was like $5,000 a year, and it's basically fire insurance. Nothing else is going to happen to a brick house except fire, right? And it had a $250 deductible. And I said, what happens if I go to 1,000? He said, oh, it drops 3,000. I said, what happens if I go to 5,000? He said, drops 500. And I said, so I save $4,500 a year for a $5,000 deductible. Do the math on that. And the rest of my life, everything I've ever done. I read a book years and years ago when I was a young physician, and it was Charles Given's Wealth Without Risk. Famous bestseller book, and that's what he taught. He said, highest deductible you can do. But then you can't cheat. You've got to make sure you have that money. You've got to have that money aside. Okay? All that deductible stuff, you can't get yourself caught, or you get in trouble and you pour yourself down. And you got to save the money that you saved and put it in an account. And I've always done that.
Making yourself your own self-insured.
Self-insured. And that's what we should be. It should be unlawful to insure the first $10,000 of health care in America. Everybody ought to have to pay their own care. And people are going to say, well, what are you going to do about the poor? And I go, we can figure stuff out for that and give them subsidies. But in 1974 in New York, they put a 25-cent copay on every prescription by law. And the rate at which prescriptions got filled dropped by 50%. Well, it wasn't because the people couldn't come up with a quarter. It was because it was free. And I have people all the time, because I'm a missionary, and they call me up and they say, hey, Doc, Grandpa died, and I got this bag of meds. And I go, why do you have this bag of meds? This is like more than a 90-day supply. And they say, his attitude was he paid his premiums, he wanted them, he just never took them. We need to stop that. So the answer is go to cash. Go to cash. If you get the highest deductible health insurance premium that you can get, and self-insure, and then don't try and use your insurance. Only keep it in case you get hit by a truck, or like me, have your kidney out 3 years ago. Okay, but year after year after year after year, I was uninsured. Was I really uninsured? No, I had a $10,000 deductible. Did I ever submit anything? No. Why would I? I never could even get close to spending $10,000. Okay? Now, the minute you get a year that you finally have that, you've got to keep all those records, because you've got to go into that insurance management system and say, this is all of the things that I've done to eat up my $10,000 deductible, and it was only $4,000, so that when they took my kidney out, I could go, I only owe $6 because I already spent $4. Well, plain fact was I was on Medicare. I didn't pay anything. My entire out-of-pocket expenses for $160,000 worth of health care was $300. We can't afford Medicare. Medicare is completely bankrupt. Anybody who says Medicare for all is insane. They don't understand anything about it. They don't understand that it's all cost shifting and all the numbers are fake. And
there's so many parts about this that are mind games that we get dealt with just like we were puppets, marionettes, because we get told, oh, it's a good thing to have universal coverage and we need everybody in the system and all that sort of stuff. What people don't realize is be careful what you ask for, because what that means is you're going to be, because of all this corruption and because of all the hidden costs and the no controls on increasing costs. In fact, it's the opposite. The system is built to feed on itself.
Yep.
Is that pretty soon you'll be working, you won't be able to retire, and you'll be working more and more of your life we gave up a vacation last year so that I could pay for that expensive overpriced medicine that was supposed to cost 1/10 as much. So that kind of thing.
Exactly.
And our good friend and neighbor had to give up retirement and go back to work so he could afford.
I have many people in my practice who are working only to pay their copays. I remember I had an old couple one time, and they complained to me and they said, Dr. Nielsen, our gastroenterologist has us on Acifex, and we're both spending $200 a month in copays to get our Acifex. And I said, I thought you liked Zantac. And she says, oh, I do like Zantac. It's much better. And I said, well, call my custom compounding pharmacist up, and I'll have him give you a price for a bottle of 1,000. And it was $13. And they took that bottle all year for the two of them and spent $6.50 a piece on their Zantac, and it was better than their Acifex, and they were spending $3,600 a year just in copays. But we're just sheep. We just keep going, oh, it's my healthcare system. I paid in. I'm on it. And I go, no, it's broken. Get out of the healthcare system and take the money you save, put it in the bank to get ready for your deductible, and go to every insurance agent you can and say, how do I get out of the system? I want the highest deductible I can get. The Democrats are trying to legislate that high deductible insurance policies are illegal.
Oh no.
Yeah, they don't want those.
Well, echoing what you were saying a little while ago about the kickbacks, which is something I wrote down when we passed that point. We're going to be interviewing, we've mentioned it in passing before, but a good friend of ours who is a cancer survivor was pushed by her doc to submit to a chemotherapy regimen. And an alternate care doc, who I know used to be a partner of yours, in a town south of here, said, why don't you get this test first to see whether you're even a good candidate for it? The test cost a couple $1,000, but it saved $500,000.
$500,000, because she was a terrible match for the drug.
But even after that test result came back, the original cancer doc was still saying, yeah, but you better do the chemo anyway, just for peace of mind.
I had a terminal lung cancer patient who got $600,000 worth of chemo over 2 years that made him bleed and bruise and had all kinds of problems, and worked a little bit. And they said, well, I didn't work in it anymore, so we're going to go to the next drug. Okay? And so he's all signed up for this next drug, and it's going to be another $500,000, and the side effects are absolutely brutal. And I asked the family, I said, have you looked into this drug? Because I looked into it, and I don't see that it's used in lung cancer effectively. I can't find any positive studies. So they went back to the guy, and they said, is this going to work? And he said, oh, it won't help you at all. And they said, why would you recommend it? And they said, because it gives you hope.
Oh, my.
$500,000 for fake hope.
Well, as I walked in for my $10,500 treatment that should have cost me $400, the copay should have been about $50, which is for a $500 treatment. I saw it, and it was in a cancer treatment suite.
Well, hematologists are oncologists.
And
You're getting treated by a cancer.
thought about all those other patients I saw around getting their chemo and getting their other things, and just thinking about all those tens of thousands of dollars all around the room just flowing out of these people's. We're paying for it in our taxes. We're paying for it in our huge premiums.
And most of them, they cannot show that they work. We've talked about that when we talked about cancer. Most of these studies, like I said, the French said that only 20% of any chemotherapy works 20% of the time. 80% of chemotherapy is less than 20% effective. I used to work with a good oncologist, and she stayed good for 1 year, and she used to tell people, I want to ask you 2 questions. Okay? They're sitting there, and she hasn't even opened up the chart yet. And she says, if you come in here with pancreatic cancer, and I tell you that I can double your survival with the therapy, do you want it? And they said, absolutely. And I said, let me show you the statistics on pancreatic cancer. 96% of people with pancreatic cancer die no matter what you do. Okay? 2% of people spontaneously recover, and we don't know why. Okay? 2% of the people, if I treat them, all of them, all 100, if I treat all 100, 2% turns into 4%. So I can double your survival from 2 to 4%. Do you still want it? No.
Once they know what they're
It's just a matter of understanding the numbers. And I tell people, go make them give you the numbers. Tell them, I am not going to do chemotherapy until you show me the 3 biggest studies that were ever done. And at the end of that, I'll take them back to Dr. Nielsen and have him read them with me at a visit. And I do this all the time, and I look at them and I go, this one worked 4%, and this one actually didn't work at all, and this one really did save quite a few lives, but quite a few people died from the therapy, and there were a lot of secondary cancers from the therapy later, but that's okay. I always tell people cancer survivors don't get a whine. I'm a cancer survivor twice now, okay? And one of those times I had very traditional care, which gave me my second cancer. My first cancer when I was 31, the treatment gave me my second cancer when I was 65. Okay? And I don't complain about that because I'm supposed to be dead. And so I have all kinds of medical problems because of that thyroid cancer I had in 1981. Cancer survivors don't get a whine. I'm here. But I don't want to be screwed. I don't want to be lied to.
And even choosing a treatment isn't always an option. I've been told by a close acquaintance, if it's a minor, if it's your child, the system may dictate to the parents, you have to accept this particular course of treatment because that's the standard of care, and if you don't, you're being neglectful and to your child, and the state takes over. So we can maybe get into that and validate that another time. But
I have a friend who had an 11-year-old with Crohn's disease, and he refused to give the drugs and wanted to do nutritional therapy, and they went into court and took that child away from him until she was age of majority, and she came back to the family, and she never got over her Crohn's. And within a year after that, with non-pharmacologic medicine, we made it all go away, and today she doesn't have Crohn's, and it's all cured. Okay, but the child abuse system removed her from her parents' home because they had no right to provide care to their own child.
So you talked about the conflict of interest and the corruption that exists in the medical financial complex, and how the companies own the companies that are they own the right hand and the left hand of both pockets as well.
Yeah.
And it's in collusion with the government regulators that are supposed to be overseeing this. And now it's getting to be where even the choice of care is going to be dictated to people.
We're losing the choices in our community. We're going to a two-party system, and they're both agreeing on their prices. We're down to a two-party system. We got a little bit of hope down there with the hospital.
Near monopoly, oligopoly here in the medical providers.
It's a
and medical
mess.
class.
And we're doing that nationwide. We're just becoming just 4 providers, just United Healthcare, Med Mutual, But in the end, it's Medicare. Medicare makes all the rules. Nobody has to pay a bill. If Medicare won't pay 1 penny for a procedure, they don't have to pay anything other. There's no secondaries allowed to pick it up. And so Medicare, if they want to say, we don't like that procedure, platelet-rich plasma, stem cells, okay, things that really cure people, they go, Medicare doesn't cover that. And now the secondary insurance doesn't have to cover it either, and they won't.
So be careful what you ask for, people, when you say Medicare for all.
Yeah,
May sound good.
not going to happen.
Find out more.
Not going to happen.
Thank you again, Dr. J. Nielsen, family doctor, for talking to us about the nightmare of medical costs and some hopeful steps people can do to take control of that for themselves and get out from underneath that monster.
It's great to be here. Thank you, Duncan.
Hey, healingyourself.life viewers.
We need your help in enabling us to continue to create great health videos for you.
So please support our mission by going to patreon.com/healingyourself and pledging any monthly amount you can.
Your pledge will also help us to afford a new Lyme peptide treatment therapy to improve our memory, and we will report on our progress to benefit you and others.
So remember, go to patreon.com/healingyourself and pledge today.
Were you going to tell them to go to patreon.com/healingyourself to pledge to help our memory treatment?
I thought I did. I'll do it. So please go to patreon.com/healingyourself and pledge today.
Thanks.